Telling someone to butt out may seem rude, but when it comes to smoking, the phrase could save their life. Erin Sinisgalli is the director of the Center for Smoking Cessation and Obesity Prevention Programs for St. Mary's Hospital, and we're talking about the Great American Smokeout, which is today.
Yes, it is. Yes, this is the American Cancer Society's event. They've been celebrating it since the 1970s, and we have an event going on in Albany today to help people quit smoking.
So what's happening?
We're actually at Whitney Young in downtown Albany, and so we're inviting the community, anybody from the community, they don't have to be a patient there, who wants to quit smoking can come until 2 o'clock today. And we're meeting with people and we're helping them quit smoking. We're giving them patches and gum and all the materials they need to do it, at least for a day. We're hoping longer, but the goal is to try to quit smoking for a day.
Yeah, it's one day at a time. So I've been seeing a lot of the ads this month, very effective advertising, anti-smoking. So I actually thought Great American Smokeout now whole month long, but it really does draw a lot of attention. You find those ads are effective?
Yes, those are actually state health department ads, and so we try to get them on air. We work with the state health department. They try to go on air as much as they can throughout the year, because when smokers see those, they're really motivating them to call the quit line or to talk to their doctor for help with quitting. And so it's all just a component of what we do. So if people are starting to become interested in quitting, and now we have an event, and we're also working with Whitney Young so that the doctors and nurses will help their patients quit smoking.
So someone's thinking, I really should quit, and the high taxes and the prices of cigarettes are not motivation enough. Yeah. So really they come in today, and what is the first step that they should take?
Okay. If they're going to meet with us today, they can just come in. We're going to talk to them about what are the things that are causing them to want to quit, to want to smoke. So when people know what's the trigger that causes them to smoke, it's easier to help make a plan for how they won't.
Now, it's also difficult when there's a family full of smokers for that one person who's ready to quit to make the change if the rest of the family isn't on board too.
Yes, that's absolutely true. So you need support people. And when couples quit together, they have a lot more success. So we always encourage people to try to quit with a spouse or with a buddy or a friend or some family member. And if the family members aren't going to quit, if they can at least be supportive, take it outside, encourage the smoker to become a non-smoker, that's great.
I've seen a huge change in attitude towards smokers over the last 10 or 20 years. Have you seen that being a result of fewer people smoking, fewer people starting, or just less societal tolerance of it?
Well, we've worked hard as part of an overall tobacco control program in New York State to change laws and things like that. So the Clean Indoor Air Act that caused smoking to stop in restaurants and bars 11 years ago in New York State was one thing that really helped people to quit, because they couldn't smoke in many places. So with a lot of different factors, that you have to be over 18 to buy cigarettes, that the price has gone up. New York has the highest tax in the whole country on cigarettes. You can't smoke inside. So all these factors together are what's really changing the culture around smoking.
So today, the Great American Smokeout in Albany, the Whitney Young Health Center, until what time?
Until 2 o'clock today.
Yes. So you know what? Do it for one day and then see if you can do it tomorrow too.
Absolutely.